Hello and welcome to the topic Non-Ulcer Dyspepsia in the module Gastroenterology and Hepatology. By the end of this topic, you should be able to define non-ulcer dyspepsia, explain the pathophysiology of non-ulcer dyspepsia, explain the clinical presentation of a patient who presents with non-ulcer dyspepsia, outline the investigations in the diagnosis of non-ulcer dyspepsia, and finally discuss the management of non-ulcer dyspepsia. Let's get started. The definition of indigestion is an uncomfortable feeling of fullness, pain, or burning in the upper abdomen area. Functional or non-ulcer dyspepsia pain is a term used to describe signs and symptoms of indigestion that have no obvious cause. In this case, dyspepsia is referred to as non-ulcer dyspepsia, and its diagnosis is established by the presence of epigastralgia for at least 6 months in the absence of any other cause explaining the symptoms. Pathophysiological mechanisms currently proposed to be involved in functional dyspepsia or non-ulcer dyspepsia symptom generation include delayed gastric emptying, impaired gastric accommodation to a meal, hypersensitivity to gastric distension, altered duodenal sensitivity to lipids or acid, abnormal duodenojejunal motility, and many others. Factors that increase the risk of functional or non-ulcer dyspepsia include consuming excessive amount of caffeine and alcohol, smoking, taking certain medications, especially non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen, which can cause stomach problems. Gastric acid secretion, duodenogastric reflux, psychological factors, environmental exposures, and hereditary causes probably do not play a major role. Some patients may have motility disturbances, but whether these disturbances cause dyspepsia is unknown. What are the symptoms of non-ulcer dyspepsia? One may complain of having abdominal pain or discomfort, feeling bloated, nausea and vomiting, multiple somatic complaints, having acid reflux, acidic taste in the mouth, stomach discomfort, constipation or diarrhea, and having decreased appetite. Among the signs you want to look out for include abdominal tenderness, upper abdominal fullness or distension, and of course nausea and vomiting. Among the lab tests that can be done include a full blood count to assess for anemia, if there's any presence of anemia, liver and kidney function tests, and gallbladder and pancreatic function tests. Well, these tests are namely done to look at the functional or synthetic functions of the organs. Non-invasive techniques such as other serology tests that can be done would be to look out for presence of Helicobacter pylori infection, and this is such as urea breath tests, urine or blood detection of Helicobacter pylori antigen in stool specimen. Imaging studies that can be done on patients with non-ulcer dyspepsia include abdominal ultrasound to look for any gallbladder pathologies or gallstone-related diseases, an endoscopy to look for any presence of stress ulcers, colonoscopy, upper GI and small bowel X-ray series, CT scans or MRI of the abdomen, and gastric emptying studies. These are all not compulsory studies, but these are among the imaging studies that can be done. Most people manage their symptoms well with lifestyle changes and medications. Treating Helicobacter pylori, if present in the stomach, may significantly reduce the symptoms. Medications to treat indigestion include antacids and acid blockers. There are two main approaches to treating functional dyspepsia, and this is by neutralizing acid and blocking its production. For neutralizing acid, over-the-counter medications such as over-the-counter medications can be prescribed. The first line of treatment for many cases of indigestion would still be lifestyle changes such as eating much slower and smaller amounts, avoiding alcohol and caffeine, quitting smoking if one is a smoker, avoiding trigger foods, and also losing weight. In summary, non-ulcer dyspepsia is a form of functional dyspepsia or indigestion. We have looked at what are the pathophysiology and the causes for non-ulcer dyspepsia, or more like risk factors or trigger factors. the clinical manifestations and the investigations that can be done to rule out other intra-abdominal pathologies, and the medical as well as non-medical management that can be carried out for the treatment of non-ulcer dyspepsia. We have come to the end of this topic. Thank you.